Well, this week, we're moving on to the other side of our state line. Kansas becomes the first state in the nation to privatize its Medicaid program.
KanCare is truly what Kansas needs, a way for us to improve the coordination and quality of care for more than 380,000 Kansans while making the Medicaid program more fiscally sustainable.
If you are one of 380,000 Medicaid recipients, starting January 1, you had to have signed up with one of 3 private insurance companies for your care. The new initiative, pioneered by Governor Brownback's administration, is called KanCare. But some hospitals and physicians have not even signed up with one or any of the plans. The governor insists privatizing Medicaid will save the state more than $1 billion in just the first 5 years. Is this move all about saving money, or is there more to it than that, Barbara Shelley?
Well, it has to do. I mean, the root of it is saving money because Medicaid is, swamping the states. As Governor Brownback just said, they're taking 380,000 people and basically putting them into private for-profit managed care plans. Now, the governor's pledged they're not going to cut the eligibility for Medicaid. They're not going to reduce rates to doctors, providers, et cetera. That does beg the question of how these managed care plans are going to make a profit and still serve the people. And I know that there's just a lot of concern amongst people that care for the developmentally disabled in particular, but all these populations. You're talking about frail elderly, pregnant women with low incomes, et cetera, how they're going to be served under this plan. And I've already heard some things about, well, children that are put in psychiatric facilities currently are evaluated every 90 days to see if they should stay. They're talking about cutting that way back to, every couple of weeks or something. Things like that. There's just a lot of concerns.
But, you've got a lot of things happening here. These are some of the most vulnerable. We've got the lowest income. We've got disabled people in Kansas. Are there concerns, though, about that some hospitals and providers are not signed up right now? Are these the sort of concerns that are overblown when any time something's going to be privatized, whether it be if the city of Kansas City, Missouri, Dave Helling, is going to be privatizing its water department? Everybody gets all upset, don't they? The P word is being used. Is this those naysayers about privatization, or are there legitimate worries about something being privatized?
There are always legitimate worries when you transition a program like this. And you're right, Nick, it may take months, perhaps years for it to fully shake out and for us to fully understand the impact of it. But let's be clear, if Governor Brownback believes you can save $1 billion over 5 years, then that is $1 billion that is now being wasted in Medicaid. The only way to save money is to take money out. And so someone has to take less. That may be the patient, that may be the private company, maybe the provider, maybe the pharmaceutical company. We spend millions of dollars on drugs for Medicaid patients, but someone is going to have to take less, or you don't save $1 billion. So the question really, and I think all of the posturing now, is all of the stakeholders trying to make sure that the other guy takes the hit and not me, and it may take several years for that to completely.
And that's true
out.
Also, Bill, because the new tax rates came into play this week also in Kansas. The governor has made some major overhaul in tax rates in the state of Kansas. A lot of bets have been made about what the future of Kansas is going to be, even economically. He could become the most innovative governor in the entire nation, or he could become one of the most foolish governors in the nation. It depends on how all of this plays out.
He's got a lot at stake here, because there's already talk that the sales tax, which was going to go down, they may have to put that on hold. And so, when you're talking about $1 billion, I think that obviously the big focus here is the money side of it, and that's something that Governor Brownback is focused on. My contention, and the contention of a lot of others, is that he is looking toward 2016. If he can save money, if he can be more fiscally responsible, it's going to draw him a lot of national attention.
Well, this is either Brownback's Waterloo or KanCare will be his platform to national prominence. Here's my problem with it. I agree with privatization. This is the fastest growing area of expense for the government, but it's been pushed through too fast. We don't have proper oversight. There's no legislative oversight. There's no independent ombudsman. These 3 insurance companies, they're out-of-state entities. So these billions of dollars are going to go outside of Kansas. And finally, the provider network was rushed through in 6 months, and there's a lot of confusion for people who are going to get services. So I think the state is moving in the right direction. They're moving far too fast.
Can I just say this quickly about Sam Brownback? I think we should keep this in mind. Broadly speaking, what he is doing is moving the burden of state finances onto the poor. He is reducing income taxes, but keeping the sales tax, which is regressive. Yeah. Part of tax reform is to remove exemptions for food and medicine that were embedded in this Kansas state tax code. He is privatizing Medicaid, the program for the poor, presumably at least saving some of the money spent to provide those services. The big bet of Sam Brownback is the way to bring growth to Kansas is to shift the burden away from the well-to-do and put it on the poorer parts of the state of Kansas and the community, and that's the experiment I think we're watching over the next 2 years.
Barbara.
Well, I just agree with a lot of what Stacy just said. We'll know a lot more about CanCare in a year, but it is rushed. The idea that some hospitals and doctors now haven't even signed up with a provider yet. They may have by this time, and they will if they want to get paid. They'll have to. But I think you're just going to see a lot of confusion in the early weeks of this program.